One of the questions I have for you, Karel, before we sort of transition, I saw a video from Seun Kuti, who is the son of the great Fela Kuti, father of Afrobeats, and he said social distancing practices and some of these things that are being put out by Eurocentric communities are relevant to those communities. But when you live in Lagos, Nigeria, in a slum, social distancing is simply not possible. You come home and you're living with 15 other people in your home, and there's just no way for you to stay 6 feet apart. And so he's calling for the leaders of Nigeria and across Africa to come up with relevant information for how they can prevent the virus, because social distancing can be possible if you live in the United States or in Europe. But to say social distancing in the context of a slum in Nigeria is simply nonsensical. What do you think about that?
It's you have 10 people living in one little room, and you have it's bad, the situation in Haiti. But I think that what the government can do is basically try to maybe quarantine those areas. No people out, no people in. Or if you go out, you have to wash your hands or do certain things. And when you go in, you do certain things. And then find a way to provide the basics to those people, food or water and things like that. Because if you let those people go out, because that's how they live day by day, so they have to go out to find food or feed their children. So if you let them go out and come back in a room with 10 or 6 people, they will definitely infect those people, and those people will infect other people. And so and those what we call bidonville in Haiti, those are like there will
at
be
risk, most
at risk, the most affected areas. So I think that the solution would be find a way. I don't know how it could be done, but find a way to quarantine those areas. And then you will have people going out maybe to go maybe do something really important, but they will be screened going out and going in. And so you don't have that spreading how we could imagine it. So I think that might be the solution.
That's definitely one way to look at it. And I think the second problem that we have, before we move over to Cate, and she can share more specific things around what's happening in the health sector and how we can look at thinking about this differently. The government issued a work from home policy and a curfew from 8 p.m. to 5 a.m. So for people who are working in the marketplace, how do you work from home? Like, how does that apply to the context that is Haiti? What are your thoughts on that?
This is really difficult. First thing, we don't have electricity. We don't have good internet. So it's really difficult. Like right now, we're using a software to communicate, and we connect a lot of people around the world together. But we don't have a lot of people don't have that capacity in Haiti. That's why you can see government offices are still open. The banks, they are rescheduling, but they're still open. A lot of businesses are still open, and they encourage their employees to come work no matter what, because they can't afford to do like working from home. I can maybe name a company like Brana. Brana is trying to do the work from home, but also come to the office. Because as you can see, it's like you can be an executive on that company, but you don't have a computer at home. You only have a smartphone. Yeah. So the company will have to maybe to provide that tools for people to work from home, but it's not that easy in Haiti.
It's not that easy. Yeah, the infrastructure is not there. So that raises a lot of questions for government. How are they going to respond in the wake of Corona to make sure that everyone, including schools, and we'll get perspective from Kassan on how education sector is handling this. But thank you so much, Kala, for giving us a little bit of an overview of how things are going on. It's good to see that there are some things in place. So it's not a completely virgin field. When you get to the airport, there is a system in place to check people and their temperatures. It seems like they're covered and they're not exposing themselves to potential people who have Corona traveling from abroad. So that's really good to know. The biggest problem will be from the streets and in the slums, and knowing how to manage those communities better in the wake of coronavirus. So we're going to switch over to Cate Oswald. And Karel, thank you for sticking around and helping us translate. We have some people following us from Port-au-Prince and Cap Haitien who might need a little bit of help with the English Creole side of things. So thank you so much, Karel, for always being there with us as a partner. Cate, you are the Chief Policy and Partnerships Officer for Partners in Health. And Partners in Health has been working in this space since the 1980s, providing high quality medical care and clinical education in Haiti's Central Plateau and Lower Artibonite. Thank you so much for joining us, Cate. Can you share a little bit about what you're seeing happening in this space in Haiti and in the rest of the world? What are some things that we need to know about what's going on right now?
Sure, of course. And thank you so much for having me. Of course, I would have loved to have one of my 6,000 Zami La Santé Haitian colleagues here speaking instead of me, but I was a citizen of the Central Plateau for about 10 years, and I know the area very well. And so since moving to Boston, where Partners in Health is based, for the last month, we had a sense that, coronavirus was spreading much quicker than, the world was paying attention to. And as a major partner of the Ministry of Health, MSPP, we had, already had plans to provide personal protective equipment and supplies and materials. They were en route, not specifically for coronavirus, but for the hospital. You may recall that one of the responses to the earthquake that we as Partners in Health employed was to help the government build l'Hôpital Universitaire de Mirbalais.
Yeah.
And today, as we speak, my heroic colleagues are treating some of the current patients who have been identified as positive with coronavirus in Haiti. And I'm happy to report that because of the strong measures of the Ministry of Health of testing people quickly, of closing the airport. So the airport is currently closed to passengers. It's only for cargo and emergency. The cases that are currently in treatment are all known, so they've been tested positive, and anyone who was a known contact of theirs that was high risk is also in quarantine. And so we have quickly adapted the university hospital to have a separate area so that patients who are coming for routine health services can stay safe. And we have treatment available and an isolation space. We've worked really quickly around the 10 countries that we work in globally to really push the same measures of epidemic control that we've seen, that we know work. I think what Haiti has going for it right now is that we've caught the cases early. We hope. And we hope that because of the strong efforts to isolate any contacts, that we won't see the community spread that we're currently seeing in New York and Boston, where I am. And that because of aggressive contact tracing, meaning following anyone who was a known contact of anyone who has been positive, that we'll be able to contain. Unfortunately, we were too slow in Italy, in Spain, in Germany, in all of the cities in the US that were
it's invisible, so people feel like it's not real.
Exactly.
Like it can't be a real thing. It almost feels intangible and like a movie that you're watching from afar.
Exactly. I think it's all, we all have faced other diseases. Many of us have had the flu. I think this is very different than cholera. We as Zami La Santé Partners in Health, the first cases of cholera were sadly right in our backyard in Mirbalais, where the UN base had been. And so, Haiti has isolation capacity left over from the cholera outbreak, but even then, 10,000 people died from cholera in the last decade. Wow. And no one should die from cholera, right? The thing that we're concerned about for coronavirus, honestly, is that while we do have the isolation capacity in Haiti, while people know how to wash hands and they know how to prevent the spread of disease, this one is different. It's new. No, we don't know there's no known treatment. And the people that have been getting the sickest require ICU level, intensive care level support.
Wow.
And so there are very few ICU beds in Haiti, as we know. We have 5 at the University Hospital in Nibale. We have not had to use them yet because the cases we have are stable, but we are ready. We've set up a special area. The team is working around the clock to get trained on how to treat, how to isolate, and how to stay safe. One of the things that we're seeing around the world right now is the shortage of medical equipment.
Right. New York has been crying out for ventilators for the past 2 weeks. So I can't even imagine on the ground in Haiti. A lot of people have actually said, and I want to give Khaled a chance to give a short Creole summary of what Kate said, if you're ready for that, Khaled. But a lot of people have been saying that since Haiti has gone through so many health epidemics, that it is more ready than other countries because there's leftover from what has happened. Is that true, Kate?
I would love to say that it's true. However, we know for a fact that the health system in Haiti varies greatly, right? And so there's access to care for in certain hospitals in Port-au-Prince and in the private system that are very different than what exists in the public system. What I would say is, while the isolation capacity exists because of what we saw with cholera, if people end up having the same symptoms that we're seeing in Europe and the US, the number of intensivists, the number of people who are specialty trained in ICU care is very limited, despite all of the incredible efforts of the medical school, of international partners, of the many training programs that exist for doctors and nurses. The equipment and the staff capacity is not as we would expect, and it's overwhelming. The system of New York, which is one of the best resourced in the world.
Yeah, one of the wealthiest cities. Khaled, can you help us with the passé?
Justement, il y a un pile bagaille qui dit, mais m'a fait résumer rapidement qui ça et si vous voulez, si il y a l'autre monde qui veut aider pour ça est très intéressant. Il dit que justement dans la santé Téguentan comme partenaire ministère de santé publique Téguentan commandé plusieurs outils déjà qui Téguentan en route avant même que choléra coronavirus a été déclaré en Haïti et c'est équipement ça justement qui a servi qu'on y a pour être capable soigner des patients que nous-mêmes nous gagnons là qu'on y a et jusqu'à présent il y a fait un bon travail. Il parlait tout de mesures que le gouvernement prend pour fermer les portes là et retracer passagers. J'aime te dire tout à l'heure, moi-même par exemple qui souhaite voyager, moi je recevrai un coup de fil pour moi dire est-ce que ma forme, est-ce que je suis capable de prendre température, etc. Et ça permet que l'espérer que ça permet que on contrôle sous maladie et qui permet que il n'y pas gailler gens que le gailler et l'autre côté et yo même dans l'hôpital Mirbalea yo gain moyen pour justement yo isoler mon yo et toujours continuer bail service à monde qui gain check-up de routine que eux même yo capable faire. Ensuite il parlait tout de en pile monde de parler de causer qui gagne côté que monde qui gagne équipement médical et qui pas gassé et par rapport au système New York, etc. Et lui-même, il estimait que tout autant que bagaille aurait été conseillé, continue à contrôler, il est capable de répondre à besoins. Et dans le cas côté que tu as un monde qui est capable de besoin aide beaucoup plus par rapport à problèmes respiratoires que le besoin soins intensifs, il y a assez matériel, mais c'est dans le monde entier que au joindre c'est pas ou pas jamais de pile monde qui est entraîné assez pour ça et malheureusement en Haïti il y a pas gagné en pile
c'est monde qui entraîné.
Voilà pourquoi il est important pour moun yo rester la caillou pour yo pas continuer.
Oui, mais si la caillou rempli monde qui parle dans marché chaque jour, ça c'est un problème. Merci Karel. So
okay, I think I recap a little bit what you said.
Ça c'est bon.
Très bien, très bien. So Kate, I have a few more questions for you before we switch it over and get a better understanding of what's happening in the education sector with Kassan. How is PIH, Partners in Health, getting access to these much needed medical supplies? Because things obviously have to be coming from abroad. We're not necessarily producing these locally. How do you get access to supplies?
Yeah, it's one of our biggest fears, and it's what's keeping us up at night, honestly. We have Dr. Paul Farmer, we have myself, all of us are calling companies and doing outreach. Dr. Jim Kim, who's the former president of the World Bank, he's a co-founder of Partners in Health. He's been using all of the efforts that he can with his former relationships to access rapid tests, to help us find ventilators and personal protective equipment. Really, the personal protective equipment, the PPE, is what we're most worried about, so that our health workers, we have a limited number of health workers in all of Haiti, right? There aren't that many in the whole country. We need to protect our heroes. And so we're actually working with some local women's cooperatives to make gowns and to make the masks locally. So learning from what's happening here in the US and in Europe, and making sure that they can be sterilized appropriately so that they're protecting lives. So that's some of what we're doing. We're actually using the relationships we built during the earthquake response and during cholera to call on the World Food Program, who has the aviation service globally, and the US military to help with getting materials into the country quickly, because we've bought equipment and supplies, but we can't get them to Haiti right now because of the air routes and the shipping being slow.
Karel?
That's it. Oh, ouais, Kate dit que plus gros peur que vous avez là qu'on y a, c'est justement pour pas gagner assez équipement, mais tout le monde qui en dedans board les amis la santé va faire tout effort multiplier contact pour être capable de joindre le maximum de matériel possible, notamment tests rapides, ventilateurs que nous sommes capables de besoin, et surtout équipement pour protéger médical qui a travaillé parce qu'il y a un nombre limité. Donc nous pas qu'à prendre chance pour infecter même monde qui a essayé de mon soin. Et puis il parlait tout de activités qu'il a fait avec des coopératives de femmes qui dans zone Mirbalet pour regarder est-ce que mesdames ça sont capables de produire équipement pour mon personnel soignant avec masque et l'autre bagaille pour protéger. Et puis après ça, il a fait contact avec OMS et l'autre autorité qui ont même des moyens pour gagner avion et gagner gros logistique pour porter équipement que vous avez acheté déjà pour arriver en Haïti dans le plus bref délai.
Brilliant. Merci, Karel. So, Cate, I have one last question for you. I had tons of questions, but obviously because of timing, we're not able to cover all of them. But right now, we've only had 8 cases reported in Haiti, and there might be more. There is a fear that people are just not reporting themselves, right? Because they don't want to be the victims of violence of people. And I saw a newspaper article, I don't know how true that is, and maybe Karel, you might know a little bit more being in the media, that one person was reported as having the coronavirus in the north of the country, and he was threatened, his life was at risk, they came and tried to ravage his home. And so there might be more cases than the 8 that we have confirmed, but people are just not reporting. Is this the case? What's happening in that space? What do we need to know about that, the reality?
This is another thing that I will beg everyone who's listening to really take seriously. Fear is strong throughout the world, and I felt this really viscerally when I was in Liberia after the Ebola outbreak. I was pulled from Haiti to respond to Ebola, and the stigma associated with people who may have potentially been in contact with someone who had Ebola, it was real, and people were being shunned, they were being turned away from their homes. We can't allow this to happen again. We have health workers who are being threatened right now as we speak in Haiti. We cannot allow this. They are the ones who are putting themselves at risk to protect the country. And we all need to collectively do as many education and awareness campaigns to help reduce some of this stigma, because what the tragedy of tragedies would be that the health workers are doing everything they can, they're putting their own lives at risk, and then they're not able to do their work because they're being stigmatized themselves.
Right.
So I will ask everyone to do as much education and awareness campaigns around the fact that if we wash our hands, if we agree to get tested, there are test kits available. It's not a question of can we get tested. If you have symptoms that you think might be coronavirus, please, 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 for all of Haiti, agree to be tested and go to the facility and protect the health workers and celebrate them. I've seen in other countries people clapping for them, not
Threatening them. Yeah. And that means also coming into the facility protected yourself, covering in all the right places. Because if you're just showing up anyhow, opening doors with your hands, shaking people's hands on the way, that's a huge threat right there. Karen?
Give me 1 second, because the live stream is keep cutting off.
Dropping.
But yes, dropping. So yeah, Kate dit que la peur, et c'est, j'aime te dire moi-même, tout son l'autre virus que nous devons éviter. À pile monde peur que pour prendre virus là, mais tout peur monde qui gagne virus là. Et c'est un problème qui est important. Il parlait de l'expérience que il fait dans Libéria avec Ebola. Il était comment il était stigmatisé en pile monde. Il pas voulu que ça arrive en Haïti. Et l'autre bagarre encore, c'est pas même monde qui malade, c'est menace que monde personnel santé eux même yo gagne parce qu'il travaille avec monde qui gagne virus là. Et il pensait que l'important pile que doit gagner éducation, il y a plus message qui passait pour faire moun yo connaître ça y et comment on doit respecter le personnel qui a soigné. Et li ouais dans l'autre pays côté que yo bat bravo, yo applaudi, moun ça yo même des héros. Et en Haïti c'est même bagarre là pour nous faire pour que nous capables ensemble et combattre pandémie.
Absolument. Nous pas avec que personne peut venir reporter tête yo parce que si ou pas reporter tête tout, ça veut dire que tout le monde qui est entouré ou cas susceptible à virus là.
Et on va ajouter que qu'elle dit tout que sous senti symptômes yo, si vous senti que mal, aller faire test là parce que c'est pas une question de est-ce qu'on a fait ou doit le faire parce que capable de symptômes yo et isoler tête en façon pour pas infecter l'autre.
Absolutely. Thank you so much, Kate. That was extremely valuable information and insights on how the health sector and our health system in Haiti is being impacted by coronavirus. We have some minimum things in place, but it looks like there's a lot that's still missing. And so as much as we can just stay home, rete la caillou, laver main, prendre précaution, it won't put as much pressure on our health practitioners and our health system to have to combat this. So please, lavez main, rete la caillou, sous capable.